What is vital sign? Vital signs are measures of various psychological statistics taken in order to assess the most basic body functions. It includes the body temperature, pulse rate or heart rate, blood pressure, and respiratory rate. Cardiopulmonary resuscitation or CPR is a life-saving technique useful in many emergency situations, including heart attack or near drowning, in which someone's breathing or heartbeat has stopped. These are the essential steps used by both medical professionals and first aider when dealing with the patients. First, circulation. Second, airway. And third, breathing. Circulation. Restore blood circulation with chest compressions. A. Put the person on his or her back on a firm surface. B. Kneel next to the person's neck and shoulders. C. Place the heel on one hand over the center of the person's chest and place your other hand on the top of the first hand. D. Keep your elbows straight and position your shoulders directly above your hands. E. Use your upper body weight, not just your arms, as you push straight down on the chest. Push hard at a rate about 100 compressions a minute. F. If you haven't been trained in CPR, continue chest compressions until there are signs of movements or until medical personnel take over. If you haven't been trained in CPR, go to checking the airway and rescue breathing. Second, airway. Clear the airway. A. If you trained in CPR and you've performed 30 chest compressions, open the person's airway using the held tilt chin lift maneuver. Put your palm on the person's forehead and gently tilt the head back. Then with the other hand, gently lift the chin forward to open the airway. B. Check for normal breathing, taking no more than 5 or 10 seconds. Look for chest motion, listen for normal breath sounds, and feel the person's breath on your cheek and ear. If the person isn't breathing normally and you are trained in CPR, begin mouth-to-mouth breathing. If you believe the person is unconscious from a heart attack and you haven't been trained in emergency procedures, skip mouth-to-mouth rescue breathing and continue chest compressions. Third, breathing. Breath for the person. A. Rescue breathing can be mouth-to-mouth breathing or mouth-to-nose breathing if the mouth is seriously injured or can't be opened. B. With the airway open, using the head tilt chin lift maneuver, pinch the nostrils shut for mouth-to-mouth breathing and cover the person's mouth with yours, making a seal. What are the difference between signs and symptoms? Signs are details discovered by applying your senses such as sight, touch, hearing, and smell during the course of examination. Example, bleeding, swelling, and deformities. Symptoms are sensations that the victim feels or experiences and may be able to describe. Example, nausea, vomiting, heat, and impaired sensations. There are two ways to conduct physical examination when giving first aid. 1. Primary survey, and second, secondary survey. Primary survey is used when the victim is unconscious and to find out and immediately treat life-threatening conditions. A. Survey the scene. Is anyone in danger? If yes, can the danger be easily managed? If it cannot, call for emergency help and protect the scene. B. Check for consciousness. Ask the victim while carefully shaking the victim's shoulder. 2. When there is no response, not even mumbles or groans, the victim is unconscious and in need of immediate medical help. C. Open the airway. The victim's unconsciousness may be due to the obstruction in his or her airway. It may also be caused by a narrowed airway, making breathing impossible. 2. Find out if there is loss of muscular control in the throat area, which allows the tongue to slip back and block the throat. 3. Lift the chin and tilt the head of the victim. D. Check for breathing. 1. Put your face near the victim's mouth and look, listen, and feel the breathing. A. Chest movement. B. Sound of breathing. And C. Feel the breath on your cheek. E. Check for circulation. 1. Locate pulse rate using your middle and index finger. Pulse rate indicates blood circulation, which is essential for the heart and brain to function. 2. Poor blood circulation may be reflected on the pale color of the skin. This is fatal. 3. To revive circulation, perform CPR immediately. Secondary survey is used when the victim is conscious or has revived. It aims to detect everything about the patient's conditions. Under secondary survey are history taking. Sample pain is a mnemonic in order to perform the steps more easily. S stands for symptoms, the chief complaint of the patient. A stands for allergy. Find out if the victim is allergic to anything. M stands for medication. What are the medicines is currently taking? P for previous illness that may be related to the problem. L for last meal, only those subject for operation. E stands for events prior to what happened. E for period of pain, how long, what started it. A stands for area. Where is the pain coming from? I for intensity. And N is for nullify, what stopped it. Steps in checking the pulse. Use your fingertips in getting the pulse. Follow the following procedure. 1. Place the fingertip over an artery where it either crosses a bone or lies close to the skin. 2. Feel the pulsations as the pressure wave of blood causes the vessel wall to expand. That is the pulse. B. Checking for vital signs. Pulse rate. The pulse rate may be taken in different points in the body like brachial, carotid, wrist, temporal, subclavian, axillary, and femoral. No in getting pulse rate. Never use your thumb. It has its own pulse. Do not palpate both the carotid arteries at the same time. Do not take the pulse when the victim is in sitting position. Pulsations disappear as the victim is elevated to a sitting position. Never put too much pressure or massage the carotid. You may disturb the heart's electrical conduction system. Normal pulse rate. Men 60 to 70, women 70 to 80, children over 7 years old 80 to 90, children over 1 to 7 years old 80 to 120, infants 110 to 130. Temperature. Guidelines in checking temperature. A. It is being important to monitor temperature in the case of stroke and high fever. B. Body temperature is measured by using a thermometer with the rectum, oral, and axillary. Respiration. Count the number of breaths per minute. A whistle, sound, or wheeze, and difficult in breathing may mean an asthma attack. A gurgling or snoring noise and difficulty in breathing may mean that the tongue, mucus, or something else is stuck in the throat and does not let enough air to get through. Between 12 to 20 breaths per minute are normal for adults and older children. 40 breaths per minute are normal for babies. Skin color. Guidelines in checking skin color. Skin color reflects the circulation of blood and the saturations of oxygen in the blood, the presence of mucus around the mouth, inner eyelids and nail beds is a sign of poor blood circulation. A healthy skin is warm and pink because blood flows normally in the blood vessels. Head-to-toe examination. Head and neck. Are there any lacerations or contusions in the area? Is there a response of blood in the victim's hair? If yes, immediately find out where it's coming from. Is there any fluid in the victim's nose and ears? If so, the victim has a skull fracture. Number 2. Eyes. Pay close attention to the pupils. Pupil appearance. Dilated pupil. Assessment. State of shock. Very small pupil. Poison or use of prohibited drugs. Different size. Head injury that requires immediate attention. Small and bright. Pupils are reactive. No reaction. Dead. Chest. Check for cuts, bruises, penetrations, and other impairments. If the victim feels pain while you apply pressure onto his or her chest, there could be a rib fracture. 4th. Abdomen. Does the victim's abdomen hurt? Where is the pain coming from? Is his or her abdomen tender? Did you feel any lumps? If yes, get immediate medical assistance. 5th. Back. Is there any movement in the victim's lower extremities? Is there sensations in these parts? If the answer is yes, do not move the victim. Immobilize him or her. Top 10 things to do in case of emergency. 1. Shout for help. 2. Survey the scene and assess the situation. 3. Determine if the accident warrants a visit to the nearest hospital or if simple cleansing and band-aid will do. 4th, you are certified in CPR and the victim needs it. Begin CPR right away. 5th, stop the bleeding if there is any. 6th, treat any symptoms of shock. 7th, look for medical alert tag in every victim. 8th, seek trained medical assistance. 9. Never give anything by mouth to an unconscious victim. 10. Wait for medical professionals to arrive.